Good morning. My name is Dave Barchett. I'm a senior consultant with Finley Davies, an HR benefits consulting firm. And over the past several years, we've been engaged with the university and the Healthcare Advisory Committee on a monthly basis, where a lot of our goal and meetings revolve around healthcare benefit trends, changes in compliance and laws, such as the Affordable Care Act. We review benchmarking statistics and just general trends in benefit offerings of other employers and specifically universities. So again, a format to continue to educate the committee and the university on some of these topics. Over the past few months, we've had a focus on, with the committee, more specific to what other employers and again, specifically universities, are offering in the form of benefit options. What we have found is that all of the IUC schools within Ohio, so there's 14 state universities, all of them offer multiple plan offerings, so more than just one medical plan to be chosen from by the employees. And we provided some feedback on that and some education. And at the last meeting in March, it was determined by the committee and voted on that they wanted to survey the rest of the employees of the university to get an overall sense of, is there a desire or a want or a need to possibly offer a second medical plan offering or even possibly a third offering. So today's webinar, that should take about 15 to 20 minutes, is meant to review what the Healthcare Advisory Committee has seen in regards to some drafts of some alternative plans. So as you'll see on the screen, our agenda is going to revolve around, what are the considerations of a second option? What's the feedback that we've received regarding the reason other universities are offering second options? We will then review a draft of an alternative PPO plan. This would be in addition to your current plan, so it would be another option potentially that the employees of the university could choose. And then we will also look at what's called a qualified high deductible health plan with a health savings account option. And of note, this option actually is currently offered to the non-represented employees of the university today. It was rolled out last fall and was introduced with a January 1, 2017 effective date. So that plan is in place, but it's in place with a limited subset of the employees of the university. So as we look at some of the considerations of offering a second plan option, some of the feedback that we've received, and this ties into really what most employers feel is, it's potentially a tool to continue to attract and retain top talent at the university. It provides employees with options in managing their take-home pay. It provides an opportunity for lower premiums, so lower contributions by the employees. It would provide an individual choice as to which plan best meets your needs as an employee of the university. And it would not disrupt those who choose to remain in the current plan. So again, what we're going to review are potential drafts of options. And again, the survey is meant to identify if there's a desire to possibly introduce a second or third option. So those are some of the considerations of the university, of the Healthcare Advisory Committee regarding offering a second option. As we look at this next slide, what we've done is we've laid out on the left side some key benefit provisions. So deductibles, coinsurance, out-of-pocket limits, maximum out-of-pocket limits, office visit copays, specialist visit copays, preventive care emergency room, and then the pharmacy prescription drug plan. Next to that is the current PPO plan that is in place at the university. that essentially those who enroll in the plan, this is the plan that's in place. We want to show you next to that the alternative PPO that's been drafted for discussion, and we'll walk through some of the changes on that. Anything in red that you see would be a difference from the current plan, and anything in green or in black represents a no change to the current plan. As you look at the bottom of this page, just before we start our discussion, this second option would drive a 12% less premium for the employees in the terms of their contributions to select this plan, just as a point of discussion. So when we look at the top of this page, and we look at the deductible for the single, for the alternative plan, that deductible would be $500 for a single or an individual. It would be twice that for a family of $1,000. And I'm going to focus really only on the network level of benefits today, which is where probably 98% of the claims are flowing through. The coinsurance level would be at 80% versus the current plan at 90%. And the out-of-pocket limit, which includes the deductible but excludes the medical and prescription plan co-pays, would be $2,500 for a single and $5,000 for a family. An important note to make about the individual limit of $2,500 as well as the deductible of $500 is that an individual within a family, that's the most that any one individual of a family can accrue to the total family out-of-pocket. So that'll be an important note to remember as we talk about the next plan design as well. Then we look at the maximum out-of-pocket, and this now does include all the deductibles as well as the medical and prescription plan co-pays. And what you'll see here is that the alternative plan actually has the same maximum out-of-pocket for a single and a family, $6,600 for single and $13,200 for the family combined. The office visit copay for primary care services remains at $15. The specialist visit would move from $15 to $40. And preventive care would remain at 100% coverage, no member responsibility in the form of a copay or deductible. It's 100% paid by the plan under both of the plans illustrated on this page. The emergency room would move to a $150 copay for services rendered at the emergency room. And then as we look at the prescription drug plan, there is no deductible under this plan today, and that would remain intact. What we've done, if you look at the way we've laid out the prescription copays, you'll see under your current plan, you'll see $4/$10. So the benefit on the left side of that slash represents the benefit the member would receive at a retail pharmacy, and the number to the right of that represents the benefit should the service be delivered through the mail order. So under the alternative plan, the generic copay for retail prescriptions would be $10, and for generic it would be a $20 copay for the mail order service, keeping in mind that that is a 90-day supply. What we've done with the preferred brand or Tier 2 level of drugs and the non-preferred brand or Tier 3 level of drugs is that we've kept the 25% co-share in place, but we've increased the maximum amount of the copay up to $40 for retail for the preferred brand level and up to $80 for mail order for the preferred brand level, and then similar increases on the non-preferred or Tier 3 level of prescriptions. A very important point I want to make about this potential alternate plan is what is not changing or what would remain the same. So number one, Medical Mutual would still be your plan provider, so that's important to know. Number two, the network that they offer today under your current plan would be the exact same network that would be available to you under the alternative potential plan. And number three, what is covered under the current plan would still be covered under the alternative plan. So this is not meant to be a decision for the employees to think about this benefit is covered under this plan, it's not under that. This is truly a benefit level or benefit cost consideration as well as a premium cost consideration. So three important things we wanted to make sure that that was clear. So as we move on to the next alternative plan, which is the qualified high deductible health plan. And again, as a reminder, this plan is in place today for the non-represented employees. So this plan would be the plan that would be introduced if it was decided that this made sense for the rest of the employees. Again, to turn your eyes to the bottom of this page, this plan would have a 25% less premium contribution for the employees who potentially chose this plan. And let me start by saying, again, what is the same about this plan is that MMO would still be the provider, the network would still be the same network that you're accessing, and what is covered is still the same. How it's covered is going to be different, but again, those three things are still intact. So again, this becomes a benefit cost and premium contribution decision. We set this illustration up the same way as the previous page. So on the left are the same provisions we went through on the other page. We have your current PPO plan laid out, and then we're going to focus on the qualified high deductible health plan and focusing in on the network level of benefits. An important point I want to make here before we get going too is that because this is a qualified plan, there are certain IRS requirements that have to be in place to make this plan qualified. One of those is that there has to be a minimum deductible in place to make this a qualified plan. There has to be a maximum out-of-pocket to keep this a qualified plan. And third, and probably most importantly, which is different than your current plan, this plan has to have a combined medical and prescription drug deductible. We'll talk more about that, but those are the requirements at minimum to keep this plan qualified, which then allows the employees to open up what's called a health savings account, which is a tax-deferred account to be able to pay for health care expenses tax-free. This discussion today is not meant to get into the advantages of what a health savings account plan does, but there is a presentation that was delivered back in the fall to the non-represented employees, and I would urge you to certainly review that presentation as you think about this plan offering. That presentation can be found on the Human Resources webpage under Benefits on the YSU portal. Any questions about that, you can certainly reach out to your HR department. So let's discuss the high deductible health plan, and I'm going to refer it to from now on as HDHP. So as the name identifies, the deductible is higher. So the deductible for a single employee is $2,600 or for an individual within a family. So as I mentioned on the last slide, the $2,600 is the most an individual within a family can accrue towards that family deductible. The family deductible would be $5,200, and then the coinsurance, actually after the deductible is met, reverts to 100% for your medical services. The out-of-pocket, including the deductible, but excluding medical or pharmacy copays, is essentially what your deductible is. It's $2,600 for an individual and $5,200 for the family. Then we look at the maximum out-of-pocket, so now we are including medical copays, which your current plan has, and pharmacy copays. And as you look at this, the maximum out-of-pocket for the HDHP plan is actually slightly less, $6,550 for an individual and $13,100 for the family. Now you might be sitting there and looking at that saying, how can I possibly get to those kind of out-of-pocket limits if above that, my deductible is $2,600, and after that I have 100% coinsurance? And that would be a great question. So as a reminder, that 100% coinsurance after the deductible applies to your medical services, so doctor's visits, inpatient procedures, outpatient procedures. What happens after your deductible is met on the pharmacy side, however, if you drop down to the middle part of the page, your prescription drug plan then reverts back to the copay, coinsurance, co-share structure that your current plan has. So once the deductible is met and you need to go get a prescription at the retail pharmacy for a generic drug, you would then pay that $4 for retail or $10 for mail order. And that $4 or $10 would then accrue to that $6,550 ultimate out-of-pocket. So that's the difference, and that's how, if a member happened to have those levels of services, that would be the ultimate cap under this plan, just like you have the cap under the current plan. Under the HDHP, you will not have medical copays. Everything is essentially subject to deductible and coinsurance, with the big exception that preventive care, like your current plan, is covered at 100%, no member responsibility, so there's no deductible, there's no copay, it is covered at 100%. We've talked about the prescription drug plan. Again, just a reminder, under the deductible section, you'll see that it says combined with medical. So, for example, if you go to the pharmacist and you've not met your, or you go to the pharmacy and you've not met your deductible yet, and the pharmacist says, would you like that retail drug for $100 or the brand name drug for $13.50? At that point in time, that's your decision as to which drug you'd want to take, but that amount that you're paying for, which is the discounted amount, would be subject to the accrual of that deductible. So it will make you look at the cost of services, certainly, as you are utilizing the plan. The very bottom of this page talks about a very important aspect of what makes this a qualified HDHP plan, and that is the ability to open up a health savings account. Again, essentially a tax-deferred account that the IRS allows, provided that you're covered by a qualified HDHP plan that allows you to set aside dollars to pay for healthcare expenses. Within this plan, Youngstown State, the university, is contributing towards this account on behalf of those who enroll in it to the amount of $1,000 annually for a single enrolled employee and $2,000 for a family. So that money is seeded into this account with the goal to help offset some of the impact of the higher deductible that this plan has in place. Again, above that, you as an individual could defer additional dollars to supplement that health savings account. Again, the other presentation I mentioned has a lot more detail on that. There are some other requirements that would have to be met to be able to open up a health savings account, but the primary one is that the employee is enrolled in, again, what's called a qualified HDHP plan. So that concludes our discussion around the plan offerings and the reason for the survey. We certainly appreciate your attention and completing the survey, and we will hopefully report back those results over the next couple of months. Thanks and have a great day.